When James Horn needed a hernia operation in 2020, he decided on a surgical approach that uses a robot, specifically the Da Vinci robot.
I know what it takes to create a great robotic system. I know that this was a really high-quality robot, that a surgeon could do things that wouldn't be possible with open surgery, that I would have less pain and also have much better, lower risk of infections. So it was like a no-brainer. It's right here in my hometown. Let's go for it.
James went to Melrose Wakefield Hospital and saw Dr. Adam Blau, Director of Robotic-Assisted Surgery. Dr. Blau says a large percentage of his operations are now done robotically.
It makes a world of difference for the patient and their post-operative recovery and their outcomes.
After the patient is prepped on the table, the surgeon positions the robotic arms into place, each arm containing tools that will assist with the procedure. A surgical team member stands near the patient while the surgeon takes a seat at a nearby console.
The surgeon controls the robot 100%. The surgeon is putting both their fingers in finger controls and using both feet to operate pedals. So the surgeon is using all four extremities simultaneously when they're operating. And that allows the surgeon to control up to 4 arms simultaneously.
Robotic surgery is a form of minimally invasive surgery where small incisions are used to allow instruments and a camera to be inserted into the area. There are a number of proven benefits to the minimally invasive approach.
Patients have less pain, they go home faster. In general, it's associated with lower complication rates and lower blood loss rates.
The robot adds to those benefits, allowing surgeons a 3D view of the area. And instead of using long, straight instruments, it allows for fluid wrist motion. Robots let surgeons perform complex movements on a very small scale, allowing for more precision and smaller incisions. Recent studies have shown the outcomes of robotic surgery are at least as good as those of other minimally invasive techniques. Doctors are quick to point out that patients should talk to their physician to decide which surgical approach is right for them.
Every patient has different medical problems, has a different surgical past history, and all of those things have to be taken into account when one is deciding, is robotic surgery beneficial for this particular patient?
Tufts Medicine has invested in robotic systems at each of its hospitals. Melrose Wakefield, Lowell General Hospital, and Tufts Medical Center. The robots assist with procedures such as acid reflux, colorectal, gynecological, hernia and gallbladder, lung, orthopedic, prostate and urological, spine and neck, trauma and emergency, and weight loss. Tufts Medicine also trains new surgeons in robotic surgery techniques.
The future of surgery will look a lot more like robotic surgery. 50 to 100 years from now, we'll probably have forgotten about most of our open surgery techniques, but we're not quite there yet. And so it's important that the surgeon be comfortable with sort of all of the different approaches.
James is a believer in the robotic approach, saying his recovery from this hernia surgery was better than the recovery from a previous hernia surgery he had years ago.
And then when I heard about this and thought, wow, shorter recovery times and less pain because the incisions are smaller and less invasive, this is perfect.